If you feel exhausted all the time, struggle with brain fog, or notice your hair thinning, but your doctor says your labs are normal, this video may explain why. Iron deficiency in women is one of the most common and most overlooked health issues in the world. And the tricky part is that it doesn't always look dramatic. It often shows up quietly. You feel more tired than usual. You can't focus the way you used to. Your hair seems thinner. You get out of breath more easily. But you tell yourself you're just busy, stressed, or not sleeping enough. And because these symptoms are so common, many women live with them for months, sometimes years, without realizing that low iron might be part of the picture. So today, I want to walk you through iron deficiency in a way that actually makes sense. We're going to talk about what iron really does in your body, why women are especially at risk, what the symptoms look like, including the subtle ones, how it's diagnosed, and what you can do about it. The goal isn't to make you anxious. It's to help you understand your body better. Let's start with the basics. Iron is essential for life. At its core, iron helps your body carry oxygen. It's a key part of hemoglobin, the protein inside your red blood cells. Every time you breathe in, oxygen enters your lungs, binds to hemoglobin, and travels through your bloodstream to your brain, your muscles, your heart. Every single cell depends on that oxygen delivery. When iron levels drop, your body can't make enough hemoglobin, and oxygen delivery decreases. And when your tissues don't get enough oxygen, things just don't run as efficiently. That's why iron deficiency often feels like a full-body slowdown. But iron isn't just about oxygen. It's also involved in energy production at the cellular level, immune function, DNA synthesis, and even neurotransmitters like dopamine and serotonin, which influence mood and motivation. It also plays a role in thyroid hormone metabolism. So when iron is low, the symptoms can show up in many different ways. It's not just anemia, it can affect how you think, how you feel, how you move, and how you function day to day. Now here's something that's really important and often misunderstood. Iron deficiency exists on a spectrum. Many people think that if they're not anemic, their iron must be fine. But that's not necessarily true. Before anemia develops, your body first starts to use up its stored iron. That storage form is called ferritin. When ferritin drops, you may start having symptoms even though your hemoglobin, the number used to diagnose anemia, is still technically normal. This is what's called non-anemic iron deficiency. And it's incredibly common. So you might go to your doctor, have blood work done, be told your hemoglobin is normal, and walk away still feeling exhausted. Meanwhile, your ferritin could be low. And while labs have reference ranges, normal doesn't always mean optimal. Some women start feeling symptomatic when ferritin drops below 30, even if the lab flags that is within range. That's why context matters. Numbers mean more when we interpret them alongside symptoms. Now let's talk about why women, specifically, are at higher risk. The biggest factor is menstruation. Every month during your period, you lose blood. And because blood contains iron, that loss adds up over time. If you have heavy menstrual bleeding, meaning you soak through products every 1 to 2 hours, bleed longer than 7 days, pass large clots, or have to double up on protection, your iron stores can gradually become depleted. And because this pattern can feel normal, if you've always experienced it, it often goes unnoticed. Pregnancy is another major factor. During pregnancy, your blood volume increases significantly to support your baby. Your iron needs nearly double. The baby needs iron. The placenta needs iron. Your expanded blood supply needs iron. Without adequate intake, deficiency can develop quickly. And after delivery, blood loss can further reduce your stores. Many postpartum women assume their fatigue is purely from sleep deprivation, but iron deficiency can absolutely contribute. Diet also plays a role. Iron from animal sources, called heme iron, is more easily absorbed than iron from plant sources. That doesn't mean vegetarian or vegan diets can't support healthy iron levels. They absolutely can. but it does require a bit more intentional planning. Endurance athletes and women doing high-intensity training may also have increased iron demands. Now let's get into symptoms, because this is where things often click. The most common symptom is fatigue, but not just "I stayed up too late, tired." This is a deeper exhaustion, the kind where you wake up tired, where coffee doesn't really fix it, where your body feels heavier than usual. Many women describe it as moving through mud. You might notice reduced exercise tolerance. Workouts feel harder. Stairs feel harder. Brain fog is another big one. Difficulty concentrating. Forgetfulness. Trouble finding words. Decreased productivity. Headaches can become more frequent. You might feel colder than everyone else around you. As iron deficiency progresses, symptoms can become more noticeable. Shortness of breath with minimal exertion. Pale skin. Increased hair shedding. Brittle nails. Dizziness. Heart palpitations. Restless legs at night. Some women develop something called pica, which involves cravings for non-food items. Craving ice specifically is strongly linked to iron deficiency. Because iron affects dopamine pathways, low levels can also contribute to low mood, anxiety-like symptoms, or reduced motivation. Many women are told their symptoms are just stress. And yes, stress affects health. But physiology matters. If your cells don't have enough iron to support oxygen transport and energy production, your body will let you know. Iron also interacts with hormones. Heavy periods can cause iron deficiency, but low iron can also affect how resilient you feel under stress. Iron is needed for certain enzymes involved in thyroid hormone production, which is why symptoms like fatigue, hair thinning, and cold sensitivity can overlap with thyroid disorders. This overlap is exactly why proper evaluation matters. When it comes to diagnosis, ferritin is the key marker because it reflects stored iron. Hemoglobin helps diagnose anemia. Other markers like transferrin saturation provide additional context. But ferritin is often the most revealing early indicator. And it's worth remembering that ferritin can increase in the presence of inflammation, so interpretation isn't always straightforward. This is why working with a knowledgeable provider is important. If iron deficiency is confirmed, treatment usually starts with oral iron supplements. Common forms include ferrous sulfate, ferrous gluconate, and ferrous fumarate. Iron is best absorbed on an empty stomach, but that can sometimes cause nausea or stomach discomfort. Take it with a small amount of food may help. Vitamin C enhances absorption, while coffee, tea, and calcium can reduce it. Some research suggests that taking iron every other day may improve absorption and reduce side effects, but dosing should be individualized. It takes time to replenish iron stores. Hemoglobin may improve within weeks, but ferritin can take months to normalize. In more severe cases, or when oral iron isn't tolerated, intravenous iron may be used under medical supervision. Food plays a supportive role as well. Red meat, poultry, and fish provide heme iron, which is absorbed more efficiently. Plant-based sources include lentils, beans, tofu, spinach, and pumpkin seeds. Pairing these with vitamin C-rich foods helps absorption. But once deficiency is established, diet alone is often not enough to fully correct it. There are also times when iron deficiency warrants deeper investigation. Severe fatigue, fainting, chest pain, black stools, unexplained weight loss, or extremely heavy bleeding should always be evaluated. And in postmenopausal women, iron deficiency should never be assumed to be from menstruation. But I want to end with something important. Many women normalize exhaustion. We push through. We work. We care for others. We meet expectations. And we assume feeling depleted is just part of life. But chronic fatigue is not normal. It's not laziness. It's not weakness. It's a signal. Your body communicates through symptoms. Iron deficiency is common. It's often missed. And it is treatable. If you constantly feel drained, if your hair is thinning, If your periods leave you wiped out every month, or if you've been told your labs are normal but you still don't feel like yourself, it may be worth revisiting your iron status. Understanding your body isn't about fear, it's about clarity. And on Women's Health Explained, that's what we aim to provide. Clear, science-based conversations that help you feel informed, not overwhelmed. Because informed women make empowered decisions, and your symptoms deserve to be taken seriously.